Dr. Ryan Yamashiro. I came to DAP about a year ago. I graduated from Loma Linda University School of Dentistry, and I started as a part-time, and it kind of just turned into a full-time job. And
yeah. My name is Dr. Daniel Joe. I went to Loma Linda as well. Let's see, I came to DAP late last year in August. That was when they were looking for a second full-time provider, and that's when I was brought on. Let's see, the reason why I chose DAP is actually I knew the previous provider that was here, working here, Dr. So, and she really recommended for me to look into working here at DAP, and so I interviewed, and I was hired, and yeah, been working here ever since. I mean, just in general, of course, like for any patient, it's really important to have, good hygiene, good oral health. But yeah, as Dr. Yamashiro was saying, because of some of the medications that they take, it can create complications in the mouth that if you don't have very good hygiene, it can definitely cause kind of more complications than a regular person. Gum disease, cavities, caries, things like that.
Some of the problems are some patients have like candida infections due to some of their medications. A lot of them have suffer from dry mouth due to some of their medications, depending on what they are, and that can cause a lot of decay. They also have problems just with dry mouth in general. They just don't really salivate that much, and so it causes a little bit of a problem for them. Try to help manage all of that with them.
It can affect their condition, like in terms of HIV. Just in general, it's important to have a very healthy kind of oral environment. Just by maintaining the teeth that they have, avoiding gum disease, trying to basically keep them as healthy as possible, and that's going to be a part of it too.
Sometimes there's not a lot you can do. There's like, we have a prescription that we prescribe to some of the patients, Saligen. Some people it works, some people it does not work. There's also like saliva replacements that they can buy at the store, any like drugstore, anything like that. ACT is a saliva replacement. I think there's a Biotine. There's different products you can use, but at the same time, it's just like a quick fix. It doesn't last all day long. So for a lot of patients, it's very difficult to kind of take care of that problem 100%. Sometimes they have to work with their physician on trying to get off meds or trying to change the med that maybe it won't cause that problem. But at the same time, the meds that they're taking are specifically kind of, for them, and so they can't really just change meds. So that's kind of a problem too that we try to manage. But a lot of it manifests like if they have some really bad dry mouth, they'll get a lot of decay. Usually comes with it. They get a lot more plaque buildup, and a lot of times too, it's kind of frustrating for them because they brush and floss, do all this stuff, but they still get decay. So a lot of times it's very like emotionally draining, I guess maybe, because it's like, why should I try since I still keep having this problem? So that's kind of a big problem too.
I'd say in terms of the changes that are happening, now we're like fully FQHC, federally qualified, which is good, I think, for our patients, and for our kind of workflow as well. We're basically, I think the biggest change that we're going through right now is we're growing. We brought on, myself as a second full-time provider. We've been adding, we have another part-time hygienist. We also have another more assistants, more front desk, and good. You know, we're kind of starting to scale up a little bit more so we can provide more services to more patients. And